Thank you, Jennifer and Mary Ellen. And by way of introduction, National Advisory Committee on Rural Health and Human Services is a 21-member citizens panel of nationally recognized rural health experts advise the Secretary of Health and Human Services on ways to address healthcare problems in rural America. Chartered in 1987, it was expanded in 2002 and charged with focusing on both health and human service issues in rural areas. And as you've already heard, one of those experts is my co-presenter today, Bill Benson. Each year, the committee selects one or more topics upon which to focus during the year. The committee then produces a report with recommendations on that issue for the Secretary by the end of the year. It's my privilege today to share with you some of the work of the committee around the issue of substance abuse, particularly as it relates to the elderly in rural populations. Opioid misuse is not just a rural problem, but we know that the rural areas of our nation have been disproportionately affected, and that also includes our rural elderly. When compared with their urban counterparts, rural elderly are more likely to report being in poor health. Rural elderly are also more economically challenged. Rural elderly are also affected by geographic isolation and a limited patchwork of health and human services available to them. Given the demographic, geographic, and financial challenges facing the rural elderly, the committee felt it should address some of these challenges in its advisory capacity. During its spring 2016 meeting, the Human Services Subcommittee examined the impact and implications of opioid misuse on rural families. Substance use disorder not only puts individuals at risk of overdose and death, but can also present a crisis situation for families. Addictions often create interpersonal problems for all family members, conflict between partners, conflicts with children, emotional trauma, and adverse health risks. The committee is also concerned about the implications for the related impacts on employment and economic viability for rural families affected by the opioid crisis. When it comes to the effect on the rural elderly, the impacts can be devastating, both directly, such as in the case of self-use or addiction, or indirectly, an example being the case of grandparents raising grandchildren due to the impact of substance abuse on the parents, and further exacerbating the need for limited or non-existent human service resources in rural areas. Over the last several years, everywhere the committee has met, almost every issue the committee has examined has led us back to substance abuse, particularly prescription painkillers and heroin, and the situation is not getting better. Since 1999, the rate of overdose deaths involving an opioid has nearly quadrupled. Drug-related deaths are 45% higher in rural areas. Opioid-related overdose deaths have increased over the past 15 years in both rural and urban areas, with exponential increases in rural areas from 2013 and 2014. Rural states are also more likely to have higher rates of overdose death, particularly from prescription opioid overdose. Men in rural areas are using more opioids than women in rural areas, but more women are dying from opioid overdose. The statistics are sobering. While this crisis has been building for a long time, it seems to have only arrived in the public consciousness over the last 3 to 4 years. The facts of rural poverty, lack of economic opportunity, lack of access to behavioral and substance abuse, and the wider effects of substance abuse all were major factors in the committee's work. Many rural opioid users are more likely to have socioeconomic vulnerabilities that put them at risk of adverse outcomes. Opioid misuse is increasing among older adults. Opioid overdose deaths are contributing to increased rural mortality and a decrease in the average life expectancy in many rural areas. The committee is concerned that the opioid crisis is having a direct and indirect effect on families and communities, with implications for health and human services. Unfortunately, the current crisis has revealed long-standing disparities when it comes to needed services. The committee has issued many recommendations over the years calling attention to the lack of mental health and substance abuse treatment providers and facilities in rural areas. And states with proportionately large rural populations compared to urban populations have greater shortages of mental health providers and fewer facilities to provide treatment services. Rural areas lack basic substance abuse treatment services as well as the supplemental services. And the vast majority of rural residents live in counties that do not have detox services. All these issues contribute to great difficulty in getting treatment for rural individuals with substance use disorder and to maintaining a family structure in the face of limited human services access in rural areas.
Like all older adults, rural elders are vulnerable to medication abuse. And there's a number of reasons for this. They use more prescription and over-the-counter medications than any other age group and may develop increased medication sensitivity as they age. They have a higher risk of accidental misuse of abuse due to conditions like sleep disorders and insomnia, as well as anxiety that occur in this population. And there is a surplus of opioid meds in many rural areas. As reported in our paper and then subsequently in the GIA's release of their version of our paper, noted a 2016 Pulitzer Prize-winning series from the Charleston Gazette-Mail in West Virginia, which found that in 6 years, drug wholesalers shipped 780 million hydrocodone and oxycodone pills to West Virginia, with 1,728 West Virginians fatally overdosing on those two drugs, many of whom were over the age of 45. The amount of pills, as the article noted, amounted to 433 pain pills for every man, woman, and child in West Virginia. And during that period, opioid deaths increased 67% in West Virginia. Adult Protective Services data shows an increase in elder abuse. That's definitive, and it's across the board. Some experts and law enforcement officials believe that the opioid crisis is contributing to this increase, but unfortunately, Adult Protective Services and others are not yet collecting data related to the connection between abuse and opioids and opioid misuse and abuse, but we are learning some things about that. We know definitively that the numbers of elder abuse incidents are huge across the country. The number of reports of elder abuse in this country exceed the combined total of reports of child abuse and domestic violence. And those numbers are growing just simply due to demographics for one reason, but we think there are probably other reasons as well. And although this is not a rural story, Boston's Elder Abuse Prevention Project, which was launched in 2014 by Greater Boston Legal Services, found that older adults were enduring different forms of abuse due to their children or grandchildren's opioid addiction, citing all forms of financial exploitation, stealing meds and valuables, evictions from public housing, physical, verbal, and emotional abuse. And while that's a specific project in Boston, we have no doubt that as we're hearing from APS and legal services programs, that this is something that's exactly the same happening in rural communities. We heard from Missouri's Adult Protective Services that they just instituted, and we applaud them for this, a tracking system for their hotline to try to flag those things that are opioid related. That was January 30th. As of February 15th, 2 weeks later, they had received 9 hotline calls that were related directly to opioids and abuse. Rural grandparents are more likely than their urban counterparts to be raising a grandchild because their adult child is addicted to opioids. Challenges that they face include raising children, physical and cognitive health problems. More than 2.5 million children are being raised by grandparents and other relatives with no birth parents in the home, and that parental substance abuse is the most common reason that grandparents are raising their grandchildren, according to the highly respected organization Generations United. Grandparents raising grandkids face not only the problems I mentioned of physical and cognitive health problems with the kids they're raising, but also problems resulting from their parents' opioid abuse, but also the potential for their own social isolation and depression, not to mention numerous legal issues they face, such as not having adoption or foster care status to access medical or education records. Marie Cervantes wrote to us at National Adult Protective Services Association recently. Marie runs Oregon's Adult Protective Services Program, and she noted that at one point in Oregon, there were about 40,000 kids living with their grandparents. And she made one point I wanted to mention here. She believes that keeping grandparents safe is a protective factor against child abuse and neglect, and may provide support for at-risk youth. So we're all in this together. Rising opioid misuse among rural elders is attributed to a variety of reasons, and I'm going to touch on some of those now. First, demographics. Rural populations, as noted earlier, tend to be older than populations in urban areas. 16% of rural Americans are age 65 and older, and rural communities have a higher proportion of those 85 and older who are more likely to have chronic diseases and disabilities, and thus are more likely to be taking a variety of medications, including opioids. Economic factors, including low incomes, unemployment, and substandard housing. Almost 10% of rural elders 65 and older live in poverty, and with poverty rates significantly higher for minority populations. Sadly, experts from rural communities told us that some rural older adults with low incomes are tempted to sell their prescription opioids for additional income or to obtain opioids illegally when they can no longer afford their prescriptions. Education. Bethany, health illiteracy is a big issue in opioid misuse, and I think we all know that. Bethany Reynolds, who runs a Missouri federally qualified health center, told us that many of her patients have only a third-grade education, and that as a result, opioid misuse is very common in her area, quote, due to poor health literacy and misunderstanding of the medication itself rather than a blatant desire to abuse, end quote. She also said many have little understanding of serious side effects like respiratory depression and potential signs of an overdose. There are social factors. Rural elders often live in close-knit families in which some accept self-medication and drug sharing, yet place a stigma on addiction or treatment for drug abuse. And health conditions. Rural older adults are prone to more chronic pain, depression, and social isolation, mostly due to the nature of rural jobs and geographic factors. Beyond the older adults themselves, I'm going to spend a few minutes talking about the impact on rural communities. As middle-aged and older adults continue to age in their communities, the Aging Services Network and other systems like Adult Protective Services will likely be dealing with more complex clients, straining already fragile systems. This goes back to my earlier comment about our concerns about the 45 to 64-year-old population in terms of their impact on aging systems. As that population ages in to aging services, which hopefully they will be doing, they're going to put more complex demands on fragile systems that exist out there now. I don't know to what extent our audience is familiar with the Aging Services Network, but across the country we have a network of state departments of aging and local area agencies on aging and a tremendous number of local not-for-profit service providers and government providers that deliver things like home-delivered meals or provide congregate meals or senior centers or family caregiving support services or case management or legal services and a number of others. Those programs are strained to the max currently, and as this population ages with opioid-related problems, it's going to increase the demands and the complexities on these systems. And of course, the opioid crisis and the demographics of an aging society, particularly in rural America, will place enormous pressure on healthcare, emergency response systems, law enforcement, and others. Just the fact of the demographics alone are going to place enormous pressure as our population continues to age, along with their attending comorbidities and their chronic illnesses, and overlay on top of that the complexities associated with opioid addiction and other factors along those lines. We have some real challenges ahead of us, not that we don't have many at this very moment.